Let's shine by seeing the best in all of us and by looking out for each other. Let's stay healthy. Let's shine together.
Hi, I'm Sherry Harlan, program host for Let's Talk Together. Thanks for joining us today. And our guest today is Amber Burns, and she is our nurse practitioner with Reid Health OB/GYN. Welcome, Amber.
Thank you.
And as we get started, tell us a little bit about your background and how you came to Reid.
Sure. So I started off as a registered nurse. I graduated in 2009 from IU East right here in Richmond. Worked actually for 13 years as a registered nurse. So I started right out of school in the ICU. I wanted to just go. I wanted that, constant adrenaline rush. So I started in the ICU over at Methodist in Indianapolis. And from there, I transitioned a little bit closer to home. So I worked in the ER in my hometown in Henry County. I worked there for 7 years. Again, just love that constant go. But then when I had my son in 2016, I had a really great delivery experience. And I really connected with the nurse that was there for the delivery of my son. And she actually got to talking to me, and she was like, have you ever thought about working in OB? And I was like, oh, no, I like trauma. She's like, you should think about it, and so I really got swayed when I was there. So I applied and actually accepted a position in the OB unit while I was on maternity leave. So I transitioned from the ER to the OB unit, and I worked there for 6 years. And that's where I really found my passion. I thought I would be bored going from that kind of constant go in the ER to kind of settling down into the OB a little bit, because it's, it's a little bit slower paced sometimes. You spend all day with your patient while they're laboring, but I really found that I really enjoyed that connection with these women at the, one of the most important days of their lives, welcoming a new baby into the world. And so I really developed my passion for women's health then. I decided that I actually wanted to expand my career and see the whole field of women's health. So I decided to go back to school, and I got my nurse practitioner in 2021. Worked in pain management for a year. It was okay. It had its own challenges. But then when this position came available here at Reid and I applied, I was fortunate to get the job here, and I absolutely love it. I love being in women's health, and I love what I do here. And
excuse me, as we get started, I know we hear so much about women's health, and sometimes we hear nothing about women's health. Mm-hmm. So the first thing is thinking in their 20s and 30s. Mm-hmm.
Yeah.
So that's a time for choices?
Yeah, so 20s and 30s, it's a time for choices, it's a time for change. Even in those adolescent years, I think awareness is just really important. And I think for so long there was, almost such a taboo around women's health. We didn't talk about these things. They were private, they were personal. We didn't talk about our menstrual cycles, and we didn't talk about safe sex and STDs and all of that. And so I think, bringing awareness to that is really, really important. So, if you start in that adolescent age to those 20s and 30s, that's when we're starting to get into that time of change. We're developing as women, and our menstrual cycles, we want to keep a close eye on those. We want to watch for those irregularities, tracking everything, starting to think about growing our families, having children. So, those time for choices and change, and I think to, be open and honest with your provider about your concerns. That's a really important time in life for that.
And then as we move on to your late 30s and 40s.
we're starting to get into that transition period. So some people are just starting their families when they're in their 30s and their 40s, and that's okay too. We want to be there to support you through the entire journey when it's right for you. But 30s and 40s, I had my last baby when I was 31, and then I was done. I was done having kids, and so now we're transitioning to that next stage in life, nearing that perimenopausal. We're starting to see some of those other changes. There's a lot of talk around that now, and I think we're starting to bring a lot of awareness to that via social media, which is fantastic. But talking about the perimenopausal changes, weight fluctuations, moodiness, irritability, something as simple as hair loss, trouble sleeping. So, that's more that transitional period of life as well.
And then as the late 40s to 50 plus.
Yeah, so that's when we're getting into those, that either postmenopausal or still in that perimenopausal change, but that's more managing the chronic diseases that we can start to develop at that stage of life, and just overall managing our long-term wellness, managing those perimenopausal changes that we see once you've gone through menopause, and so being there to support that time of life too. Women's health across the entire spectrum is just very important, from the first day of your menstrual cycle when you're 11, 12, 13, even after you've gone through menopause. There's still lots of room there for screening and treatment and education, and so you're never too old or too young to seek out care of an OBGYN provider.
And we're going to go through some of the things for no matter what stage of life they're in.
Yeah, absolutely.
Things that we should look at for as like eating healthy.
Oh yeah, eating healthy is so important, and it's kind of like the fuel for your body. You want to put good fuel in your car. We want to put good fuel into our bodies too. And I think so often people come in and they're like, oh, they just told me I'm overweight and I need to change. Well, that's just a small piece of the puzzle. Yes, your diet, your exercise, your lifestyle habits, your size, all of that can still play an important role in your health. And so making sure you give your body that correct fuel that it needs to function properly is really important. And so I hope people know that we're not judging you because you don't eat well or because you're a little bit overweight. We just want you to know that can also play an important role in some of the issues you're having. 20, 30 extra pounds can cause you to have irregular menstrual cycles. They can be longer, they can be shorter, they can sometimes go away altogether. But it all kind of plays an important role in how our bodies function.
And another thing is being active.
Very important, yeah. And I think, so often we think, oh, I need to go to the gym, I need to lift weights, I got to run on the treadmill for 30 minutes. Going outside and taking a 10-minute walk after you eat dinner can be so beneficial. It helps your body digest its food. It helps stabilize your blood sugar. It can just be so important to do something so small as a 5 to 10-minute walk outside. Park in the car a little bit further away to walk into the store, taking the stairs instead of the elevator. So all of those little changes really do add up. And I think that sometimes we want to kind of, overcomplicate things, and it doesn't need to be complicated.
And one of the, when people say, I just don't have the time, and one of your things is promote flexibility and balance.
Yeah, so, finding that time somewhere, even if it's parking a little bit further away when you go to the grocery store, or, I currently work on the second floor, and so I take the stairs up to my office versus the elevator. So just little things like that. So fitting it into your lifestyle. You don't have to get up at 5 a.m. and go to the gym at 5 o'clock in the morning and then shower and be at work by 7. Don't make this something that doesn't work well for your life. You have to make it to where it's going to fit into your lives. We are all so busy. And I think as women, we tend to find ourselves most of the time as, everything kind of falls on our shoulders, or at least we feel that way, So we're responsible for the kids, we're responsible for the cooking, the cleaning, all the other stuff. And so I think we tend to put our wellness and our health kind of on the back burner. I think it's easy to do, especially as a mom. I have 3 kids, as you saw from that picture, they're 7, 8, and 14. And so my life kind of revolves around them most of the time. And so I think, at night, my kids, they go to bed at 8:30. And so I get my walking pad out and I watch my show on HBO, and I, walk for 20 minutes on my walking pad. So finding something that works for you and fits into your lifestyle is what's most important, and something that you enjoy.
Right. Another factor, stress.
Ugh. I mean, Come on.
We meant that.
Did we just talk about the 3 kids that I have? Yeah. Stress, we lead such fast-paced, stressful lifestyles right now. And so, yes, diminishing that stress can be very important, but sometimes that's not always possible. So finding ways to help cope with that stress can also be very important. And that's in finding something you enjoy, a hobby that you enjoy. Some people enjoy yoga, meditation, a 10-minute walk. Put your headphones in and listen to an audiobook and go for a 10-minute walk. Something small that just kind of helps bring that level down. That combined with a good diet, good sleep, healthy sleeping patterns, all of it, kind of like we talked about, it's just like a big puzzle. It all kind of works together to kind of make us who we are and keep us healthy.
I was looking at, it says 75 to 90% of doctor visits are stress related.
Yeah.
It's pretty frightening.
It is. And, stress really has an adverse effect on our body. It's hard on our bodies. It's hard on our hearts. It can raise our blood pressure. It can, put excess strain on all of our organs. It's kind of like a domino effect. And so a lot of times if you start tracing things back, you can see, stress management can be really important in help reducing some of that.
And with those the different parts of stress, for instance, digestive problems.
Yeah. So, struggling with, I think stress manifests itself in different ways. I think some people, when we get stressed, we overeat. Some people, when we get stressed, we undereat. I am unfortunately an overeater.
Overeater.
Yes, correct. And that's hard on our digestive system. And, in kids, I don't know if you have little kids or did have little kids at some point, but I don't know how many times my kids will wake up in the morning and say, oh, my stomach hurts. And I'm like, well, why does your tummy hurt? Like, do you have something big going on at school today? And they had a test or they had gotten in an argument with a friend. And so in kids, that tends to be how their stress manifests. So it does have, that physical component to it as well.
And what about the immune system?
It decreases our immune system substantially. Stress puts an increased stress on our body, and our body responds by kind of taking away from the important parts and, focusing all its energy on the important parts like our heart, our brain, our lungs, and that type of stuff. So immune system can be decreased too when you're experiencing high incidences of stress.
And what about are there more immune system issues with women than there are men?
Yes, there can be. A lot of it depends on our jobs, what we do for a living, how we handle stress, because a lot of times our body's working really hard, especially when we're pregnant. If you ever notice, when people are pregnant, they tend to be more easily susceptible to colds and stomach bugs and all of that because our immune system is decreased when we're women. That time of the month, our immune system can be a little bit decreased because our body's working hard to deal with that aspect of things. So yeah, we've got those hormonal fluctuations throughout the month that, we're just blessed with, but sometimes our body puts more energy into working with that than our immune system.
And you spoke earlier about the cardiovascular and the nervous system issues. That happen.
Yeah. So it puts excess stress and strain on our heart, raises our blood pressure, which puts excess strain on our kidneys, also back to the heart. So it really is just a whole big kind of vicious cycle. So
and another part of the cycle is sleep deprived.
Yes. Sleep is so important at night. That's when our body, it rests and it rejuvenates. And we need that rest. It's very crucial to our bodies to have that downtime and that good, adequate sleep and to get in that REM cycle for our bodies to heal and to recover and rejuvenate. 8 hours of sleep is great. If you could get 8 hours of sleep, 7 to 8 would be better, but making sure you're getting into that good sleep as well is really important.
And then the other is weight gain.
Yeah. Weight, kind of like I said, unfortunately, I think some people come in and they feel like we're targeting just their weight. And I try not to word it that way. I try to explain, it does have an adverse effect on your health. It can throw off your hormones. Estrogen is secreted in our fat cells. So a lot of times, the heavier we get, we're going to notice some menstrual cycle irregularities that's going to predispose us to diabetes, insulin resistance, and those metabolic disorders can also play a role in our cycles and how our body manifests that.
Good there. And another thing is we're looking in for like screenings. And
Yeah.
I see that you brought some
I did.
aids for us.
Yeah, absolutely. So one of the main screenings that we do in our office, obviously, is pap smears. I have a lot of people come in and they have been told, oh, I don't want a pap smear, it's gonna hurt. I've been told it's gonna hurt. It's gonna be uncomfortable. So I kind of wanted to talk a little bit through the pap smear and explain what it is. So a pap smear, what it is we are going in and collecting a little bit of cells from the outside of the cervix. We're looking at those cells under a microscope and looking for any changes that could be indicative of cervical cancer. So I brought a speculum. This is what a speculum looks like, and as you can see, it's not super big. It goes in just like that into the vagina. We put a light down here in the bottom. Some people use the plastic, some people use the metal. It's just whatever you're most comfortable with. I prefer the plastic. But basically what we do is we go in through the vagina. We go kind of at a downward angle, and then we come up until we can see the cervix. So the cervix looks like a small little donut. So this is kind of a visual here. This is the vagina, this is the cervix. Cervix looks like a small little donut at the end of the speculum, and then you'll hear open, does one little click. And what we're doing is we are looking at that cervix. So we're looking at it first to see if we see anything abnormal on the outside. Then once we see that cervix, we take these two little collection devices. One is just like a little plastic spatula, one is a little brush. And then if your cervix looks like this, like a little donut, we take this and we run it just real gently along the outside. Just a little plastic scratch, that's all it is. You don't even feel it usually. The next part is we take this little brush and it goes just barely inside the cervix. We twirl it around a little bit and then we take it out. Then we put this in this liquid cup here that goes off to the lab. The lab looks at the specimen under a microscope and looks for any abnormal changes. The nice thing is with cervical cancer, if there is a nice thing to it, but the thing is with cervical cancer is that when detected early, it is one of the most treatable forms of cancer. And so, we recommend starting these at 21. I tell patients, even if you've never been sexually active, you should still get a pap smear. Cancer does not discriminate as to whether or not you've been sexually active. So you should still get a pap smear. If you start them at 21, you get them every 3 years as long as they're normal. Once you turn 30, we start doing them with HPV co-testing. So we're also looking for HPV. HPV is the human papillomavirus. There are hundreds of strains of HPV. We're specifically looking for the ones that are 16 and 18, which increases your risk of cancer. Okay. So that human papillomavirus, if you have it, can take those cells and make them cancerous. If you get the HPV co-testing with your pap smear, then that's good, and it's normal, then that's good for 5 years. So really, more than anything, it's just more awkward and uncomfortable. It should never be painful.
So they need this earlier they needed it when they first started every 3 years.
Yes, yeah.
Does that time change?
It can. So let's say that we do a pap smear and it comes back what we call ASCUS, or atypical cells of undetermined significance. So we're like, something makes the cells look a little bit different. It could be something as simple as a yeast infection, or you just had intercourse. A lot of times we plug these results into what is called the ASCCP guidelines. That's the accrediting body that we use, and we use their recommendations for treatment. So say your pap smear comes back what we call ASCUS, or atypical cells, we'll repeat that pap smear in a year. If it comes back and it looks like precancerous changes, then we would refer you on to what's called a colposcopy. A colposcopy is basically the same thing as a pap smear with a couple different changes. So we still go in with the speculum, just like we do during the pelvic exam with the pap smear. We visualize the cervix, but this time what they do is they put a little bit of substance on the outside of the cervix, and then they look at the cervix through a microscope. And they're looking to see if they see any specific areas that look concerning. If they do, then they will go in and clip off a little piece of that and send it off for a biopsy.
And when you mean by clipping off a little piece, it's a little piece,
It's a very tiny little piece, yeah. So they've got these tiny little The NPs in the office don't do it, the physicians do, but they have these very small little clamps, and they basically just snip off a tiny little piece of that cervix. Very small, not cutting out a big chunk or anything like that. It is a little bit more uncomfortable, just because it is a little bit more invasive and a little bit longer than a typical pap smear. But again, cervical cancer, when detected early and in its earlier stages, is so treatable. So all of this is really important for long-term wellness.
And when we're saying about cervical cancer, then just you also do routine screenings as well?
Yeah, yep. So, you know, I always tell women, even if you're not due for a pap smear, say your pap smear is not due for 3 more years, I still recommend a visit every year to your OBGYN provider, just because I do think we go a little bit more in depth when it comes to the women's wellness portion of things, but also a yearly pelvic exam even, just to go in and make sure the cervix looks good, the vaginal tissue looks good, we don't see any abnormalities. So I still think a annual exam is important too.
The other kinds of, so do you also recommend screenings for breast cancer?
Yeah, so I also recommend anybody over the age of 25, we also do a breast exam in the office as well, just to look for any changes, any breast changes, skin changes, lumps, bumps, nodules, anything like that. Then we also look at other wellness screenings while you're there. So we say, you know, have you had a colonoscopy? Have you talked to your primary care doctor about a colonoscopy? Once you're outside of the age of menopause, we can start talking about DEXA scans as well, which checks the bone mineral density, make sure your bones still look nice and healthy after you've gone through menopause as well. So we do look at all of those routine wellness screenings. And I think that even if you do have a primary care doctor who does all of that, and then we just do the PAPs and the pelvic exams, it never hurts to have a second set of eyes on those and make sure that all of those bases are getting covered.
And tell us a little bit more on the DEXA screen.
So the DEXA scan, it's a full body scan,
Okay.
and basically it's just looking at the bone mineral density. Specifically, it's looking at the hips and the thighs or the femur bones, and seeing, you know, if you still have good bone health. The most important thing you can do is taking a daily multivitamin. So taking a daily multivitamin that has a combination of calcium and vitamin D, as well as some type of weight-bearing exercise. So that would be, you know, a 10-minute walk, a 15-minute walk every day. So that weight-bearing exercise that builds up the osteoblast in those joints can also help your bone health as well.
Okay. Warning signs of breast cancer. Mm-hmm. So can we go over that?
Yeah,
We have a great slide for that.
Yeah, absolutely. So they used to recommend that you check your own breast every single month. Now the recommendation is more self-breast awareness. So you come in, you see us, we do a really good breast exam, and we say, okay, this is what your normal breast tissue feels like. If you notice anything outside of this, you need to let us know right away. So you can kind of see here from this picture, you want to look for any skin changes. That's going to be really important. You want to look for any dimpling, any puckering, any drainage from the nipple. There's can be a lot of other changes. I think a lot of people think breast cancer and they think, oh, there's a lump or there's a knot, but sometimes it doesn't always show up that way. So those skin changes, that dimpling, that puckering, you have one nipple that pulls in and one stays out, you know, then obviously the hard lump, but that skin kind of peel, like orange peel skin, sometimes you'll see that on the breast tissue. Any of those changes, definitely let us know right away. We do still recommend, you know, self-breast awareness, and everybody's breast tissue is different. Some people have what we call denser breast tissue. So they have tissue in their breast that's very lumpy and bumpy, whereas some people's is just more softer. So being aware of what your normal breast tissue feels like, and then being able to kind of keep an eye on things and watch for changes.
What did you, one of the things we also look at are with the various screenings that you offer. What's something that you would like every woman to know?
So one thing that I think that everybody should know is that not everybody's the same. So I have a lot of people come in and they'll talk to me and I'll say, well, what about this and what about this? Well, my friend did that and it didn't work. Well, that's very true. It may not have worked for her, but everybody's body is different. Everybody's body reacts differently to different things. So I think it's really important to know that just because something didn't work well for somebody else, for example, a certain form of birth control or a certain medication to control cycles, just because it didn't work for one person doesn't mean it's not going to work for you. So I think, keeping an open mind is very important. And I also tell women, once you've gone through menopause, so that is 1 full year of not having a cycle. So menopause is technically 1 day. So that 1 year anniversary of not having a cycle, everything else is postmenopausal. If you ever have any vaginal bleeding once you've gone through menopause, that is not normal. And you should definitely reach out to either your primary care doctor or your OBGYN right away.
And one of the things that we do before we end, tell me about Women's Health Day.
So Women's Health Day is something that we offer at Reid. Very cool program. You actually come in, you get to see a OBGYN first. Then if you're due for a mammogram, you can go get your mammogram. And then if you're due for a DEXA scan, you can also get your DEXA scan on the same day. So it's kind of a little one-stop shop, which is really nice. We have somebody from our office that goes down there, and they are offered on the first and third Thursday of every month. And so if that's something you're interested in, you're at that age where you're due for your PAP, your mammogram, and your DEXA screen, just call, let them know that's something you're interested in, and they can get you scheduled for that.
And get you started. And if someone wants to come in and meet with you or another person in your office, what would they do?
So they would just need to call the OBGYN office and just request to set up an appointment. You don't have to have a referral. You just call the front desk and ask for an appointment, and I would be more than happy to see you or see anybody. And we've got amazing providers in our office. We really do. I work with some fantastic physicians, nurse practitioners, and nurse midwives. So we have some really great people up in the office as well.
Oh, great. And Amber, it's been a pleasure to speak with you today.
Thank you.
And thank you for joining us on Let's Talk Together.
Let's shine by seeing the best in all of us and by treating you here, right in your hometown. Let's look out for each other. Let's stay healthy. Let's shine together.